Welcome back, everybody. Time for a health update this morning. Dr. Ernst von Schwartz back with us. We're going to talk COVID in a moment, but I want to start with this new study on diabetes. It's troubling. Over the last 20 years, this study's been done. We've seen a major spike in younger people in the U.S. getting both type 1 and type 2 diabetes. What's the driving force behind this?
Thank you for mentioning that, Joe. It's very interesting that retrospective studies over almost 20 years showed a 45% increase in type 1 diabetes among children, teens, and adolescents, and a 95% increase in type 2 diabetes, which is usually considered the adult onset diabetes. And there are several risk factors, of course, and several causes for that. And one of the biggest one, especially for the type 2 diabetes, is childhood obesity, and also maternal obesity, and in particular also the existence of diabetes in one parent or both parents or grandparents. So these are all risk factors. And the onset of diabetes in young age has major implications for the future of those individuals, in particular with regard to development of atherosclerosis, of heart attacks, of strokes, of blindness, and renal failure at very early ages.
It brings up a really good topic, especially with COVID going on. You know, diabetes is certainly a risk factor if you get COVID, or if you're obese, another huge risk factor. What are we seeing in hospitals now with COVID and the people that may be the most impacted by it?
Absolutely. Diabetes is considered a risk factor because it does affect many, many organs, in particular the blood vessels. And we know that COVID is in part a disease of the blood vessels and clotting of blood vessels. So with regard to the children, we actually have seen a 50% increase of diabetes-related hospital admissions for children during the pandemic. That was another recently published study. And also with regard to COVID, there was a significant increase of children admitted to hospitals with COVID, with a total number of 180,000 all over the United States. The number of death cases among children, fortunately, is relatively low, but 23 children died as of the last days in the US of COVID, which is a more than 50% increase over the week before, but the total number is less than 0.1% compared to the adults.
Absolutely, which is still very much positive, even though it is concerning overall. The Pfizer vaccine getting full approval, do you think it's a game changer?
I hope so, and I think so, because many people who were hesitant to get the vaccine were waiting for a full approval. So Pfizer has approved that for adults, actually for people above the age of 16. The company, as well as the FDA, still warns about using the vaccine in children, and that's not recommended at this point. And Moderna is awaiting its full approval within the next coming days.
Dr. Ernst von Schwartz, a great update there on two very important topics, COVID and the diabetes pandemic, which we're also facing in this country as well. Thanks for joining us.
Thank you, Joe.